And one member of the FDA advisory committee who voted for emergency use authorization of the Pfizer vaccine is Dr. Ofer Levy, director of the Precision Vaccines Program at Boston Children's Hospital. Dr. Levy, thank you so much for your time. I want to dive right in here because you voted in favor of the emergency authorization for use in people at least 16 years old. There was some debate about making 18 the minimum age. How important is it, do you think, to vaccinate minors on some level to stop the widespread transmission?
Thank you for that, Whit. Yes, I voted in favor. And regarding the topic you raised, there was some discussion among the committee about the exact age cutoff. There were individuals who were 16 and 17-year-olds. There were participants in the study in that age range, somewhat fewer than the other age ranges, but they were there in the study, and there was no particular safety signal from that teenage group, the 16, 17-year-olds, that was different from anybody else. So the majority of the committee voted in favor for 16 years of age and up. These young teens are, in the community. They're working. They're out there. They're at risk for infection. And we believe the vaccine will be effective in preventing COVID in those 16 and 17-year-olds as well if they receive the vaccine. To be clear, we still don't know. We know the vaccine is excellent at protecting people against COVID disease, right? But we don't know if it reduces transmission between individuals. Those studies are very important and still need to happen. So we'll learn more about that particular aspect.
And I had a follow-up on that part of it, because in reality, young people wouldn't be part of this first group of vaccinations anyway. But I'm a parent. I want to be able to protect my kids, just like other parents out there. Are we doing enough to study this vaccine on children? And when will we know if it's safe for them to get it?
Thank you for that. So we do need to do more studies. Safety comes first with vaccines. And despite the record speed with which this vaccine has moved forward, no corners were cut on safety. I've looked over the data. The Pfizer, the sponsor, has looked over it. FDA has independently analyzed it. There was rigorous safety monitoring for this study. We do need pediatric studies in younger age groups. Younger kids are not at very high risk of severe COVID, but we do see infection in children, as you know, and it's possible that they could also spread the infection within the community, although we need to determine if the vaccine prevents spread. So those studies, as you point out, are very important, and I believe those studies now will move forward in younger age groups. Another angle in the long term to think about is that vaccine programs have been best developed in a pediatric sphere. So of course we need to ensure that any vaccine is safe in the age group we give it, and we have to determine how good the vaccine is at reducing spread. But theoretically, in the future, if there's good safety data in pediatrics and the vaccine can reduce spread, then down the line that might also be a very important part of the immunization campaign.
We heard Dr. Fauci address this in our earlier report, but I wanted to ask you as well. There are also concerns about allergic reactions to the vaccine. What do Americans with serious allergies need to know?
What these Americans need to know is that, first of all, as has been reported, there were 2 cases in the United Kingdom, to my understanding, women in their 40s who received the vaccine there and apparently had some sort of acute allergic reaction, possibly an anaphylaxis. My understanding is they were treated and they're doing fine now, is my understanding. The vaccine needs to be given in a healthcare facility where there's the possibility to pay attention to somebody and observe them in case they do develop an allergic reaction. That's not going to be a common event, but if it does happen, they should be able to take care of you at the facility. That's what Dr. Fauci was pointing out. The vaccine emergency use authorization documents that just came out last night, I just reviewed them early this morning, point out that the vaccine has to be given in a facility that can monitor and take care of you if something unusual occurs, and also points out that, of course, if anybody is known to have allergy to the components of this Pfizer vaccine, then they shouldn't get it.
Dr. Levy, thank you for your work and thank you for your time this morning. We do appreciate it.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.